Hello, everybody. This is Glenn Dupke from Impact Health and Wellness, and welcome to Headaches, Cause and Effects by Dr. Robert Yanda.
Well, thank you all for coming. I know it's great to take your evening and come down here, but I hope that we'll show you something that'll be worthwhile. So anyway, headaches are a big deal, and most people have had them. Most people have had many kinds of headaches. So what I'm going to do today, I'm not going to try and be systematic. I'm going to talk a little bit about general ideas about headaches, and then I'm going to go through some of the main things that cause them, and then my experiences about how to help the worst kinds. And so in the medical view, these are some of the main kinds of headaches: tension headaches, dental headaches, drug rebound headaches, toxic, cluster headaches, migraine, sinus headaches, menstrual headaches, and there are a bunch of others. And really these are largely descriptions of either what they think caused them or where they are. So a dental headache is caused by the teeth, and a tension headache would be a muscular headache, and so forth. Cluster headaches and migraine headaches are a little bit different because no one knows what causes them. Okay, so they're really just names for terrible headaches and a certain kind. So the first thing about headaches is to understand what it is that hurts. It's not your brain. Okay, the brain has no pain receptors at all. So it's the other stuff in the head that hurts. And these are the basic kind of things that can hurt. The meninges, which are the covering of the brain, the vascular system, the arteries and so forth, are full of nerve fibers. Organs like the eye, the ears don't seem to cause headaches, they cause earaches, but normally people don't get headaches caused by ears. Sinus headaches, we're all familiar with that. Joints in the skull, some of them are like in the TMJ joint, but in addition to that, there are a lot of little, they call them sutures, which are, because they look like sewing, because they're so jagged, little joints in the skull. Some of them are inside the skull. And I believe those are of main importance. I'm going to talk about that more later. And then the cranial nerves, which come out of the skull. So those are really the options of things that hurts. So what we try and do then is understand what can hurt them, okay? And the first one I'm not going to spend much time on. The medical field spends a lot of time on this, although they're very rare in my experience. I mean, I've been doing this for 30 years, and I don't know that I've ever had a person with a headache caused by a tumor. But anytime you go into a hospital with a headache, most of the time they will run MRIs and so forth to try and find out if you have a tumor of some sort causing a headache. So in my experience, they're very rare, but of course, when you do find them, they make a big difference. Allergies are a big deal for causing headaches. I'm going to talk about those. I'm going to talk about all these. I'm just going to quite quickly review them. Reflexive connections, so that especially in Chinese medicine, I'll go through a little bit of that they think that a headache, a problem in one part of the body can cause a headache. Structural headaches, which are of sort of chiropractic strong point, toxic and infectious headaches. And so I'm going to talk more about the last three probably than the rest of them. But now, allergic headaches are a little bit messy conceptually because allergies themselves are messy. They don't have clear boundaries. The things that cause them overlap each other a lot. And the treatment for them is a little bit messy. So, but generally, an allergic headache can be caused either by an external allergen or by something in the body that changes the metabolism so you become allergic to things that you wouldn't normally be allergic to. So, for example, if you have an intestinal infection, that can cause inflammation in your intestinal tract, and then you get swelling of the tissue in the intestines, and all kinds of stuff gets through the intestine that shouldn't, and you can develop allergic reactions to that, and you can get sinus problems and red eyes and headaches and the whole thing from something that you're not normally allergic to just because you had something irritating your gut. So this is generally the cycle where you have allergy coming in. It can stimulate the immune response, which can be an autoimmune response. Okay, I'm not a big fan of autoimmune theory, but it is true that the body does attack itself, and it can be either because the tissue is defective or because there's an infection commonly. So that causes inflammation, and then you can get leaky gut, which we just talked about, and nerve irritations and more allergens, and the cycle can continue until you're almost paralyzed. Usually these things are resolved either by trying to find out if you have an organ involved, like the intestinal tract, what's upsetting it, or if it's an allergen, getting away from it and deconditioning your response to it so that you don't respond to it so much anymore. Now, in Chinese medicine, and also in Western medicine, we have concepts that if you have a stomach problem, it can cause a headache, or if you have a gallbladder problem, it can cause a headache, or a liver problem can cause a headache. In Chinese medicine, they usually visualize it as an energy flow. And in Western medicine, things like foot reflexology, they regard it as just a reflex thing, so that if you have a liver point, you push on the foot on the liver point, and it causes the liver to drain, and you can relieve headaches. Also involved in this is the idea that the body has a holographic organization. And so, for example, in Chinese medicine, they have the whole body mapped out in the ear. And so, in fact, any part of the body that is a thing, the sternum, the face, the nose, the ears, the eyes, that have the whole body mapped out redundantly in it. And so, presumably, any organ that was disturbed would also have potential for causing headaches from a holographic means, although no one knows what that is. I've talked to many people about it, the smartest people I know. I've never met anyone that had any idea what it was about. But it's recognized as a phenomenon. Now, structural headaches, in the chiropractic model, chiropractors usually think of usually spinal problems, and there's an outflow of nerves from the spine, and so if the spine becomes disturbed, it'll disturb the nerve flow going out. More often than not, there's really something wrong, and the muscular and structural joint problems are because something else is disturbed, and the body's reflexively responding to that. So I put a TMJ joint up here, but very often, for example, if you get a TMJ infection, then the muscles around the TMJ joint will splint, okay? And then the muscles grip, and you can get either trigger points in the muscles that are gripping all the time and get headaches from that, or it can pull the skull together and it can compress the joints in the skull. And a lot of people get things like that, but in this case, if you just try and treat the structural problem, you won't resolve the headache. It'll tend to come back over and over again. So if it was an infection of the joint, you want to get the infection out first and then treat the muscles and so forth after that to try and relieve it. So, but you have the same thing of nerve irritation, inflammation, and these can be caused by infections and allergies and all that kind of stuff, all of which can trigger structural problems in the body. So now I put coffee in here as a toxin. I regard coffee as a health drink, although it is slightly toxic. And because of that, if you're not a good detoxifier, the toxins from coffee build up in the body. And people who drink a lot of coffee can have terrible headaches. Many, many years ago, I had a woman who came to me, and she was a teacher in school and actually had to leave school only 3 or 4 days a week. And she'd been doing that for like 30 years. And so after questioning her and finding out she drank a lot of coffee, I guessed it was a coffee problem. So I had her go off of coffee, and like I told her, usually it's when you detox coffee that the headache occurs. It's not when you drink it initially. And so she had, of course, the worst headache she ever had, and then they went away, and she never had another headache after that. But generally speaking, if you respond to coffee with headaches, it's because you're not detoxifying well. So you need someone to help you help your liver and so forth detoxify, and then you can drink coffee usually without a problem. But the consequences of toxins causing headaches can be quite extensive. Many times they're caused not by coffee but by infections in the intestinal tract, and that's extremely common. And many times the only symptom someone will have is a headache. They won't know they have an infection. So, but once you get a toxic input of some sort, you'll get nerve irritations, and then you can get the leaky gut problem, which we mentioned, and the whole cycle with that. And also, many toxins cause changes in the vascular system in the head. So there's big arteries and veins in the head, and if they spasm, they can cut off blood flow to the head, and you can have hypoxic headaches. And I don't know if any of you have been to high altitudes, but when you get really high up, like I have friends that have been to Tibet, and whenever they go over the high passes, everyone on the bus is doubled over on the floor with splitting headaches because of lack of oxygen to the head. But the same thing happens if you have a vasoconstriction of the arteries in your head. Okay, and so a lot of toxins can do that, or they can vasodilate it and stretch the head and also cause headaches. This is just this one study that shows you that infections from staph can cause vasoconstriction in the heart. So it shows you that this definitely does happen. So now, a big interest of mine is headaches caused by infection, because I've become interested in infection in the last several years. And the two most common places are stomach infections and infections that are actually in the head. And infections can occur almost anywhere in the head, the vascular system, but also the joints like the TMJ, but all these joints here, and some of them are inside the skull, can become infected. And for reasons that I'll talk about a little bit more, I believe that the worst headaches, like migraines and cluster headaches and all that, are all caused by infections inside the joints of the skull. And also the eye can become infected. And so here's another study where they found out that just curing Helicobacter, which is a stomach infection, will help migraine headaches. But this may well be that because the bacteria many times actually get into the joints of the skull as well as in the stomach. Okay, we're used to thinking of the Helicobacter infection as being a stomach infection, but when you test for them, they end up all over the body. So I'd like to talk about the worst kind of headaches now, which are the migraines and cluster headaches. And so I'm just going to review. These are called triggers. And since no one knows what causes headaches, they try and identify all the different things that can cause them. And if you read through them, hormonal changes, especially in women, foods, any kind of spicy food, salty food, food additives, drinks, alcohol, wine, caffeinated, stimulating, things like that cause headaches. Stress, okay, chemical changes. What these things show you is that these people are on an absolutely hair trigger. Okay, these things don't. Obviously, this is not the cause of the headache because we all have exposed to these kind of things. But some people are incapacitated by these kind of things, and about a year and a half ago, I have a DRX machine here, which is a machine that fixes spinal discs by traction people. And I started noticing that when the part of it that treats the neck, you have to put them in a harness and put a strap across the head. And so it tends to compress the head a little bit when they're being pulled. Well, some people are so sensitive, they simply can't get on the machine. And so other people can pull the machine to its limit and they have no reaction at all. So I started wondering, really what was the problem here? So since I've been interested in infection, I started to check these people for infections. And what I found out was that 100% of them have infections in the skull. Okay, they all do. And so as I started having people come in with severe headaches, And by the way, when they put them on the thing, they get headaches. Okay, when you compress the skull. In fact, it's well known, like when they do some of the radiographic stuff in the skull, where they treat brain tumors and stuff like that, they often mount a thing on the head and turn screws to make it tight so it won't move around. Those people get splitting headaches from that many times. And so just compressing the head causes headaches. But as far as I can tell, it's mediated by infections in the skull. And I had, about a year and a half ago, I had a woman that was sent to me who had one continuous headache for 6 months, 24 hours a day. She lived in a dark room with ice packs on her head. And she went to the medical doctors, and they gave her a drug that was so toxic that she went blind from the drug. And so she went to another doctor who took her off it, and her sight eventually came back. And he had told her that if she had stayed on the drug for 1 more week, she would have been blind for life. And so, needless to say, when she came to see me, she was scared to death of drugs and wouldn't go to doctors anymore, rather have her headache. So anyway, I tested her, and she had infections all through her skull, just like everyone else does. So I started treating her skull infections, okay? And within 4 or 5 treatments, her headaches went away completely, and she has no more headaches anymore. And I was really astounded that something that severe was resolved so easily. And so since then, I've had a few more. Like I had another guy who had absolutely splitting headaches at 2 o'clock every morning. So he would go to bed at 9 or 10 o'clock, 2 o'clock like clockwork every morning. He'd wake up with a splitting headache. He'd get up, put ice packs on his head. It would take him 2, 3, 4 hours to get back to sleep. He either wouldn't get any sleep for the rest of the night, or an hour or two at the end just before he got up. And he'd been doing this for 10 years. And so a friend of mine sent him in here, and I tested him the same things. His sutures of the skull are full of infections. So I treated him only like 3 or 4 times, and all his headaches went away. And have never come back. Then I recently had another guy come in, and he's had headaches since childhood, since he was like 10 years old. He's had splitting headaches. He goes to bed every night with his head packed in ice packs. Okay, this is how he goes to bed, and he rarely sleeps very well because the headaches are constantly waking him up, and he has headaches all day long. This has been going on for 40 years. Okay, and so he came in, and I tested him, and he had infections all through the sutures of the skull. So I treated him once. Okay, and I didn't see him for 10 days. I called him up, and he said he had had one light headache since the first treatment. Okay. So anyway, he's coming back in the next year or two, and we'll treat him again, but I think it'll just be another treatment or 2, and he'll be done. But I'm reasonably convinced that that's what causes migraines and cluster headaches. And I spent a lot of time recently on PubMed trying to find out what the medical field thought about infections in the sutures, and I could not find a single article, a single study, a single blog, a single reference of any sort to an infection in the skull, in the sutures of the skull. They have things on osteomyelitis, which are infections in the bone, but not in the sutures. And so as far as I can tell, this idea has never occurred to the medical field. Okay, it's just completely not there. And I think it's what's causing these problems, and this is why they haven't solved it, is they've never thought of this. Okay, it's a very simple idea, it's a very powerful idea. So anyway, at the moment, I'm very optimistic. These terrible headaches are not hard to fix at all. So to determine this, I usually use applied kinesiology, which is muscle testing, and to my knowledge, it's the only thing that will pick up these kind of infections. There's a lot of skepticism about it, except from people that have been around it a lot. I don't know anyone that has been around applied kinesiology and is really familiar with it that really thinks it's stupid. But the medical field generally looks down on it, but they also don't solve the problems we can solve with it. So it's not very convincing to me. So as I mentioned, the migraines and the cluster headaches. By the way, cluster headaches are called suicide headaches. They're so severe that a very large percentage of people have them. I think something like half the people that have them commit suicide, okay, because they're that bad. And if you can fix them in a day or two, there's something clearly missing here. So anyway, I went over those. So what to do if you have a headache? And because a lot of times people just either put a cold pack on it or take an aspirin, something like that. And I'm not opposed to any of that, but since there are many causes of headache, it would be worth a little bit of knowledge just to try and figure out what to do. The first thing I would do is try and figure out if you have an upset stomach at all, okay? And just, even if it's not a lot, usually if you have an infection, you'll feel some disturbance in your stomach. If you do, try taking acidophilus, okay? It's a very simple thing to do. I've stopped hundreds of headaches just giving people acidophilus. So it's a very easy thing to do, and anyone can do that. If that doesn't do it, then I would look for yeast infections, because yeast also produces mycotoxins, and the mycotoxins directly poison the skull and brain and all that, and you can get bad infections from yeast. Anyway, usually people who have yeast infections know it because they live on heavy carb diets and they have a lot of mucus and so forth. So anyway, if you do that, you need to treat yourself for yeast, and there's different ways to do that. So if the stomach, if your stomach is upset and the acidophilus doesn't help it, you might look for intestinal allergies, okay? And I would try the simple things. There are a number of foods that you go online and look up a number of foods that commonly cause intestinal problems, okay? If you're not successful, go see a doctor, okay? But it's very likely something that will cause headaches. Stress, if you have headaches and you don't have stomach problems, then look for muscle spasms, okay? And if you have those, then try rubbing them and see if it helps the headache. A lot of times it will. Check your coffee. We already talked about that. If you have coffee, try stopping it. Usually you'll get a worse headache and then it'll go away. If you have sinus headaches, the sinuses are usually sore and you can just push on them. And if they hurt, a good chance that that's a factor. So, and as far as the cranial sutures are concerned, if you don't know them, just get an anatomy book out, see where they are, and start pushing on them and see if they hurt. If they do, there's a good chance that that's a factor. So.